Hey everybody, I wanted to talk to you today about another type of heel pain that we see very often. I had previously talked about the Achilles tendon, but I want to focus on insertional Achilles tendonitis today. So that's inflammation of the Achilles tendon right where it inserts on the back of the heel bone. So a lot of folks will come in with pain on the back side of their heel bone, which is not quite as common as pain on the bottom of the heel, but it's still very common. So we can get inflammation of the Achilles tendon right on the back of the heel. It's often caused by a really tight Achilles tendon, amongst other things. The treatment is generally pretty easy. We talk about stretching, icing, and anti-inflammatories, and also sometimes we will add a little heel lift, okay? So I recently had a question from one of my good friends, Dr. Lucas Marchand. He's the house call chiropractor in Sioux Falls. He asked me what heel lift do you use for Achilles tendonitis. So this is the one that we usually use here in our office. It's a very simple heel lift. Basically, we tell you to put this underneath the insert that's in your shoes, and it has a couple of different layers, okay? The whole purpose of this is to just lift the heel up slightly to decrease the tension on the Achilles tendon at the insertion. Now, that's not the only treatment we need to do. Again, we need to use rest, ice, anti-inflammatories, stretching that out. Physical therapy is often very beneficial for this Achilles tendonitis. The goal of this, though, is again to decrease the tension on the Achilles while we're doing those other things to decrease the inflammation of the Achilles tendon. And generally, within a few weeks, the heel pain goes away and people are doing really well. You can get back to all your normal activities. So if you're having heel pain, try those things. Get yourself a little heel lift. Let me know how it goes.